In Rwanda, there's no Ebola case. Currently, we don't have a case of Ebola. However, we are prepared and we've put in place measures to prevent the spread of Ebola to be able to cross in the country. So we'll have seen that we've deployed measures of protection across our different borders. So these measures are for preventive reasons. There's intense screening and other methods of preparation to be able to prevent the cross of Ebola. So it's important that the country gets ready, and all measures have been put in place, be it in all our borders, but also in the health sector. All our health facilities, all our healthcare workers, and the entire system is in place and in sync to be able to prevent the spread of Ebola in Rwanda. So the different measures. Number one is to prevent that the case actually even happens. So because we know where the cases arise from, you've seen that we've put measures in place, including no entry in the country from people coming from zones that are affected by the outbreak. That's one, in the DRC. Number two, for Rwandans who might have been in those places, because the characteristic of the disease is that you start showing symptoms between 2 and 21 days. We've put in place measures that Rwandans who might have been in those areas, when they return to Rwanda, they'll be put in a quarantine for those days to be able to prevent that. That's one. But two, the health system has put in place infection prevention and control measures to be able to quickly prevent, detect, or respond, and if the case arises in that sense.
And what precautions and behaviors should the public adopt during the public health threat like Ebola?
Absolutely. One is, Ebola is a hemorrhagic fever. So you have classic symptoms that tells you that the person might have Ebola, and those are, fever, severe headache, vomiting, general body weakness, diarrhea, and others. Those are the classic symptoms of Ebola. It's clear to mention and important to mention that Ebola doesn't spread in the air. For a person to acquire Ebola, you need to have been in contact with bodily fluids of an infected person. So that's where we put and we emphasize on measures of prevention, including hand washing. We urge Rwandans and people living in Rwanda to have very serious hand hygiene, so washing hands with clean water and soap, avoiding getting in contact with bodily fluids such as saliva, blood, vomiting, and others. These are the preventive and protective measures that people can put in place. But these measures generally, we say that measures that actually protects against many other diseases. So it should be a culture that we have as Rwandans and people living in Rwanda to be able to wash our hands with clean water and soap. What we tell people here in Rwanda is to just go about their business, continue their lives normally, attend to their function, to work and to other events normally. We are just, heightening up a little bit our surveillance and vigilance, but everything is normal. We are in a normal situation. The country is just running normally as any other normal day. We're just heightening a little bit of the surveillance and vigilance.